Today's speaker is Dr. Ágnes Virga, who is currently the Chief of Emerson Health Neurology. Dr. Ágnes Virga is a board-certified neurologist and psychiatrist who has decades of experience with diagnosing and treating migraines with the newest treatments and approaches. Dr. Virga is a graduate from Debrecen University School of Medicine, after which she worked at the Boston Biomedical Research Institute and the Boston University Neuroanatomical department until she was accepted for her residency at the UMASS Medical Center, where she also completed her neurology fellowship. Currently, she is the Chief of Neurology at Emerson Hospital in Concord, Massachusetts, where her practice focuses on migraine. As a migraine sufferer herself, she can identify with the difficulties the migraine sufferers face and dedicates her efforts to change the general approach to migraines. For this attention in her work, she was recognized as Community Physician of the Year in 2024 by the Massachusetts Medical Society. Additionally, and this is how I know her, Dr. Virga is an active member of the local Hungarian community. She's a medical ambassador of segitseg.ma, MA's Hungarian program, and a board member of the Hungarian Medical Association of America, as well as secretary of the Hungarian HMAA's New England Chapter. So take it away. Thank you.
Thank you. Thank you so much for this wonderful opportunity to talk about this condition, which actually affects millions, billions of people in the world, and 12% of the US population. Can you imagine that? So in that room, can you just raise your hand if you or you know anybody who suffers from migraine? Oh my God. Migraine is not just a headache, because if you raise your hand and you think that, oh, you had either you had headaches or somebody else, did you ever heard that, oh, that's just a headache, take an aspirin, go home, take an Advil, why do you make a big deal about it? But people don't know how serious of condition it is. And it, as you see, just a little bit of a, illustration from a Franciscan monk from the 13th century. It's not a very nice feeling, is it right? The migraines. So, okay. And migraine is an interdisciplinary problem. Psychiatry, GI people here. You know how we ridicule the people, the doctors a few hundred years ago, that they treated everything with the GI, purging all these things. And then there is the big new discovery that, oh, gee, the GI and the brain work together. Is it right? No, the microbiome and everything, it's like a new era of science. They knew this hundreds of years ago. So here it is: pulmonary, cardiovascular, other neurological problems, sleep disorders. So it's a big comorbidity. So a lot of people who sit here in different disciplines, interested to hear about it probably. So that's an extraordinarily prevalent neurological illness. It's 1 billion people worldwide. Actually, it is the third most prevalent illness in the world. You probably did not know about that. It is amazing that 12% of the population in the USA suffers from migraine. It's more women actually than men, 1 to 4, but men are very much involved as well in that, unfortunately. Actually, you know that this is the 6th most disabling disease in the world, which people don't realize. And the reason for it, because it's underdiagnosed and undertreated. And that's why we are sitting here, because you wouldn't believe, but even this time, 21st century, I still see patients every day who say, oh, I have this since I was a teenager. And they never really treated me, or they said that, oh, it's nothing serious, and here am I, and I have to lie down. My husband cannot take me anywhere. We, have to leave my work. So most migraineurs might have an attack a couple of times a week or a few days a month, but it can go to a daily headache cycle. Probably you know about that they never free of headache. They have just this sitting headache, and it sometimes turns into a really bad one. And people get used to this. They tell me, oh, that's just the way of life. I always have this headache. And it's not okay. You don't have to. So the migraine is not just like a pain, like you hit your elbow and you have a pain. Not at all. It's a very complicated chemical change in the system. We will talk about it a little bit, but it affects, if you know about migraine, it's not only a pulsating severe headache one side or another, but then you can have visual disturbances. People sometimes cannot speak well. They go numb or weak on one side or another. They feel terrible. They have nausea, vomiting, diarrhea. So obviously it affects the whole system. And that's why taking an Advil or a Tylenol would not work. They are pain medication, but they don't work on that chemistry. So just a little illustration again, a little 19th century etching, how people feel with the migraines. And just literature is full of the descriptions of migraines. For example, here is Desdemona trying to cure Othello, who has a horrible migraine. And here is Juliet, Juliet's nurse, who suffers horrible migraine before the marriage takes place. Their migraine deeply affects the life, your life, my life. I still remember occasions when I couldn't go and I had to lie down, and it's terrible. But so it can affect the life. So just a few famous people. You see Darwin there. You don't see on the bottom, but it's a little letter to his fiancée, where this had a horrible migraine before his marriage, and he's writing that he's not sure if he can make it to his own wedding. So here is Ralph Waldo Emerson, who that's a good one.
I can see that someone marriage is very much associated.
Yeah, yeah, that is. You will see later on. It is true. So Ralph Waldo Emerson, who writes that citizens who were afflicted by this, you know, they were isolated, lonely, and when they get rid of the headaches, they can go back to their life. Here you see Ulysses Grant, you know, before the day before General Lee surrendered, he writes down, it's his own writing, he had a horrible migraine and tried all kind of mustard on the bottom of his feet and all kind of things, and he didn't know how will he survive the next day. And then General Lee actually sent messages that he wants to surrender, and he still wasn't himself. And he gave them actually very pretty good conditions. And he wrote in his book that he didn't feel himself. There is this post-migraine when you are still not okay. And he was very mellow, and he wrote, "What's wrong with me? I should be so happy about this event, but I'm just down and I don't care." And, you know, so it can affect lives very much. So here it is. It can diminish the quality of life very much so. And what is interesting on the bottom, that children can have migraines, which is very rarely diagnosed. Headache, you want to skip school, you know, just lie down. That's and I see people 5, 6 years old, and they do have migraines, and they should not be dismissed. So unfortunately, it can be inherited from both parents, more on the women's side, but from the father's side. And if you have, unfortunately, both parents, then you have like you know, at least 80% chance that you will have a migraine also later on. So that's just a little bit of a poem again from the 16th century, Robert Herrick, about asking Sappho to ease the migraine. So how about the treatments? And I love the history of medicine. And one of the points which I brought with the GI specialty, that a lot of things which we do know for migraines did actually thousands of years ago, and you will see it's coming back like a big new discovery. So, for example, the Eber's papyrus remedies from 1550 BC, they suggest an onion crushed in honey and taken in beer. They had some kind of concussion. Chopped bat, wasp dung, and fresh milk. Sounds pretty good. How about of lead mixed with cat and dog dung? So that's also pretty good. But you know, the two deities in Egyptians, Isis and Ra. So ISIS was treating RAS headache with this kind of mixtures. But it's an interesting on the bottom, one of those which they describe. You see the leaves of willow. And do you know what willow was the aspirin? Who said aspirin? Great. He is good. So that's where the willow tree, the aspirin came. So it has a reason. So here it is, one of the French kings, the people who were fighting, you know, in 16th century, they thought that the pike, the fish, they got the skull, the pike has very sharp teeth. So they scratched the king's head until it was bleeding. And then it was really helpful, apparently. So they gave that skulls to the different rulers to have their migraines. Here is a nice little, you know, nice little axe there to chop your head open there. So as you know, the treatments were, even as we talk about it now, the different theories about the migraine. So the treatments are aiming at that. For example, the humoral, you know, as you learned about it, the 4 different humors caused it. Then, okay, I went off. So anyway, the different theories which can cause headache, and they were aiming at that generally. So here we go, the non-drug treatment since the Hippocratic periods. So bloodletting was very popular, and they used the arm veins, head arteries, bleeding from the nose, like they stuck up some very nicely sharpened feather up to your nose and made you bleed. And the more the bleed, the less blood in the head, so the headaches got better. Leeches attached to you, they were very useful also. Now, how about the withdrawing other bodily fluids like cupping? Do you see these athletes, the elite athletes with the cupping sides on them these days? So they did that to get out all the blood and energy from the body, and blistering, like cutting wounds to your body all over, and then it supposedly helped a lot. But there is even a more invasive. I read an article about cauterization where they described that like a burning hot rod, and they dug it to the head, and they write that it's better if it goes deep to the bone. So if the person survived it, probably then felt better after that. But like incisional garlic, so they cut up your head and put garlic to those incisions. So that was very popular. I don't know. It's
There's a whole onion.
Trepanation, you know, trepanation is they drill a hole to your head. So they did it already 8,000 years ago. So they did that. And then other stuff, oil in the ear, the warm bath, it's very good, but they put all kind of stuff to the water and poke the feet in the water too. That was popular. I read about this 10th century, very intelligent, otherwise Arab doctor who suggested binding dead mole on your head tight. And so supposedly, how about the magnets, either waving around your head or hitting the head with the magnetic rods? And then they started to do the electrical treatments. So that's a few little picture about the trepanation already. Nice little axe what they used in some cases. And here is, if you see those pictures, you know, lying there, how were they doing this? There is a cat lying there here and checking. I don't know what the cat is doing, but so, okay. And then all this humoral and bloodletting. Later on, you know that the 16th, 17th century, the French, English literature, they started to print out doctor recommendations, and they went back. Actually, they still thought that the ancient things were very helpful, and they put it to their recommendations even then. So a few little things like the leeches to use behind your ear, nice little bloodletting, some dead moles drying there. So that's, it was hard, as the doctor described, to find dead moles. You have to really look for it. Yeah. That's dead moles landing. Yeah, they are lying there. Okay. So how about the electric treatments? You see everywhere the electric treatments all over. So they do it, Galen already called it counter irritation. So put a torpedo fish on your forehead. So seem to be very helpful, and how they cured the Emperor Claudius with the migraine. And the other thing is the electric things, what they described. So it says that if you or a slave, whatever, has a bad headache, so you put one hand on the top of the head, another hand to you know, like a container with the electric fish or the raya, and then that will cure the headache within minutes, you see? So then they started to do new therapies, electricity to the head, sympathetic nerve, all the physical treatment, compression of the artery, vibration therapy, shaking the body. Do you know that they used Parkinson with the vibration, because they noticed that when the people were traveling on a coach on a, you know, on a very uneven surface, and it shook them like crazy, the Parkinson people get much better. So they thought that the migraine also is better if they shake the person. So I don't know, but we do some of these treatments these days. Then the psychotherapy came, of course, and radiotherapy, when they thought, that slide which did not come up, that it was hormonal and the pituitary gland might play a role. So they started to radiate the poor pituitary gland, which somehow did not help much. And then surgical procedures, ear, nose, throat, cutting them up, digging up to your nose. Later, lumbar puncture and ligation of blood vessels, like, you know, that they did close the carotid artery, hoping that the blood will not get up to the head. So that's not very good idea. Or the middle meningeal artery, so that's not very good, but at least it's like on the surface, but outside of the brain. But the carotid, it's not, it's kind of iffy. So a little bit of a picture, the lady who is treated with the electricity, they bombard her with electric treatments. And here it is, a little nice little nose device. They stick it up all the way and they shake it, and you know, that's a nice vibrating therapy if you survived it, if they go up all the way. Then the idea came that too much blood in the head. So they built a huge centrifuge. They put the patients in that huge centrifuge and they were spinning them around. In 1940, actually, they built it. It somehow did not work out that well. So it's still, it's not happening these days. A few little things, radiation therapy. You see, it is quick if it's safe. It is sure. So it says X-ray exposure. You can come, you know, 10 minutes radiating the head, and then it gives relief in 15 minutes, 25, you know, very cheap to do that. And then came psychotherapy era, Freud and Möbius, who suggested that it's all in your head. Yes, so that's it is. It is. So they are suggesting that psychotherapy, suggestion, and placebo therapy is the very good way to go. But you know that Freud had terrible migraine. You know how he treated his migraines? Cocaine, that's what he was taking. He wrote it down, actually. I love to read these old letters, and he wrote that I had again, I barely could make it to Vienna, so I took my cocaine and it helped me pretty fast. So again, a few little ads already in the US, but you can buy all these nice little liquids. And here it is, Bromo Seltzer, new edition, for 10 cents. And if you go, then it's piano and organ accompaniment will be there for you to help. So that's pretty good. So what can we, a lot of lessons can be learned from the old treatment and the current treatment. Pharmacotherapy was always, as we read about it already from the centuries ago. And then non-drug treatments have been applied. So deep brain stimulation. You remember all this vibrating up to your head, to the brainstem, what you saw. And then occipital nerve stimulation in the back of your head. They did it before. How about all these surgeries digging up to your deep centers? There is a heart treatment, which they did some heart, also God's heart, everything. But probably you heard this newer thing in the last 10, 15 years, but people have a little hole in their heart, opening between the chambers. So they thought that if they close that hole, then the migraines will get better. So there were very contradicting from New England Journal of Medicine and Beth Israel and other, they were fighting about it. So now they dropped it. So insurances don't pay for it, but just mentioning. Transcranial magnetic stimulation, where are all our experts? Here they are, wonderful treatment for everything. You remember the head vibrating therapies, you know, that's, there we go. How about the electric therapies? We have all this TENS unit, putting all this electric stuff in our head, the wrist and everything. And suction cups. Did you see the suction cups? This is a new rage. And then they did it already before. How about poisons? Botox. How about Botox? I do it all the time. I mean, treat them. How about the magnetic rods, which they were waving around the head? They were, you know, they are using it now with great success. So just a few very old, like a suction cup to your head. And here you go. Who is there? Michael Phelps, you see? And the Olympics. So he's doing that even now. We always suggest all kind of non-medication therapies, of course. You can do all your, you know, relaxation and everything, meditation, healthy lifestyle, it's all good. But it's a really bad chemical change actually in the body. And if you are a person with a responsible job, you have family, you don't have time to lie down for hours and meditate, whatever you might need to be treated. So there are very different newer treatments. For example, the triptans in the last 25 years, they were the gold standard. They are serotonin agonists. Serotonin is one of those little chemicals in the brain which plays a big role in migraines. Drop of serotonin actually starts this whole process in the brain with the inflammation and everything, and the electric wave going through the brain. So the triptans act like agonists, like acting like a serotonin. So there are the sumatriptan, nortriptan, whole version of them. Very good, we still use them. They work very well. It's a little bit limited because it constricts the blood vessels. You cannot take too much. Some people have a little cardiac feeling from it. So it's still very good. We still use them. Then there are other ones which were all working on constricting the blood vessels, ergotamines, midrin, but we don't use them that much anymore. But the new breakthrough therapy is the CGRP receptor antagonist. So these are CGRP's calcitonin gene-related peptide. It was just discovered about 10 years ago, relatively new. But as you know, like with everything, it takes several years to put it to the market. So they came really about 4 years ago, and they are excellent. I tell you, it's life-changing for people because it does not cause any side effect. It doesn't knock you out. It doesn't make you tired. They are really wonderful. So Nurtec, Ubrelvy, Zephyr nasal spray for people who need fast relief or wake up with the headache. They don't have time to wait for a pill working. How about transcranial magnetic stimulation? Actually, it was approved for the migraine treatment. I don't know if you use it for that, but it was approved. And there is a device, it's called Cephali device. It's a external trigeminous nerve stimulator. Put it on your head. Insurances don't cover, but you buy it for $350, whatever, and it's yours. You don't have to refill it all the time. It sometimes works, sometimes not really, but it's not a pill, so it's helpful. Sometimes we use Depakote or a short taper steroid to kill a really bad. Sometimes people have days, a week of migraine, and it doesn't want to go away. So we use that. Just one little thing about listen to the patient. I came from Dote, and my old professor, who was actually feared very much for many reasons, but I remember he told me that you have to sit down and listen to the patient. And if you listen carefully, after 5 minutes, they will tell you what's wrong with them. And if you still have no idea what's wrong with them, you will never know. So, and so I still cannot help it, but I still do it that way. So if those acute medications don't work, there are some rescue medications, nausea medications, sedatives, some narcotic painkillers, muscle relaxants. They can work a little bit, but they don't aim at that chemistry, the serotonin and the calcitonin gene receptor peptide. They don't work on that. They help with the pain generally, or people who have the muscle tension, clenching their teeth. Many people tell me they carry all the stress on their neck, and then the headache comes from that. Probably you experience that. So it's just a little starting our days. So when you have enough of migraines, severe, like for 2 a week as a guideline, it's time to give some preventive therapy. Preventive therapy means that it's not a painkiller. You take it every day, whether you have a headache or not. And they work on either blood vessels, constricting them, helping in different ways, calcium channel blockers, beta blockers, helping them. And we use them antidepressants, but the person is not depressed. So sometimes people look at on the, online, and they say, it's an antidepressant, I'm not depressed. That's okay, it works on that chemistry. Hypertensive medication, we give it to people who never had high blood pressure. It works differently. Seizure medication, actually, there was one of the 17th century doctor who thought that migraine was like a seizure in the brain. Actually, it was also ridiculed later on, and how he was right. There is a lot of excitatory hyperactivity, and we use seizure medications, Depakote, Topamax, gabapentin, lamotrigine. They help actually with migraine. And we get to the botulinum toxin, which was the first approved, FDA-approved preventive medication in the world, or USA. All these others, which we always used back then in Hungary and the USA for prevention, they were all off labels, but they were somehow accepted and promoted anyway. So just migraine prevention, again, it's a new era for preventive therapy, wonderful. There are different versions of it. So there are the once a month injections. It looks like EpiPen. You don't deal with a needle, just click once a month, and that's it. Aimovig, Emgality, HOV. There is a new one, which is once in 3 months infusion. It's called Vyepti. There are pill forms, which wonderful, Polipta, Nurtec, and there is a nasal spray for those who wake up and they need fast relief. It's very good, it just tastes horrible. This was the groundbreaking new migraine treatment. And I don't read the whole thing, but in all the different specialties you are here, researchers, I see, monoclonal antibodies are the big thing now. We use monoclonal antibodies for everything. Is it right? For cancer, for autoimmune disease, for MS, for GI, rheumatoid diseases. And so it broke into the migraine treatment, and they actually happen to work beautifully. So they either attack the protein itself, this CGRP, or attach to the receptor, so they block it. The CGRP starts this big process of this migraine. So if you give this CGRP to a person, within 20 minutes, they develop horrible migraine. So we have to block it. So it is just an IV treatment, which is relatively new. So botulinum toxin, talking about the poisons, is it right how we left at them, the poisonous results and the treatments? Here we go. It is one of the best treatment for migraine. This was the first one approved. And it's not working only like paralyzing partially the muscles, but actually it does work in the inner chemistry too. And so it works very well in the combination. And the good news is that it is reversible. I usually don't see any side effect on the patients from it, but even if you had a little bit, maybe a tiny droopy eyelid for a couple of weeks, but everything goes away, which is related to Botox. So this is where we give this forehead, the temporal, how people have the temporal headache, clenching their jaw. They feel terrible tightness there. And then in the back of the head and the trapezius. And the needles are tiny. Nobody complains about them. And it's every 3 months. So if you want to know more about it, I was on Channel 5 Chronicles. They came to my office, and one of my grateful patients agreed to go through the whole process there. But I put there all the papers where you can find it. So many reasons why people like to, yes?
Well, for Botox, is it, you put the amount where it would have the physical changes that people usually who get Botox do? So if you go for Botox, usually you're not doing it for migraine, right?
Oh, well, they used to for beauty. No, but it's, they discovered actually initially that people went for the beauty, and then if they got enough, they say, oh, gee, my headache is better. So they started to do this big study. And then they found that actually in certain amount, it's not a big amount, and it's given to a small amount in very different areas. Well, I have to admit that some of my patients who have this frown line and they get there, they don't mind at all. So that's okay, but it's not for beauty. So, but we use it for other things too, torticollis and all kind of other spasticity. But migraine is very popular, life-changing. It was very nice to hear actually what people say. So there are, of course, all these researchers here, these young, wonderful researchers, and then they do a lot of new studies on that. What is the cause? It's such a popular, not popular science these days to look, since it affects really millions, even billions of people. So they worked about the different causes we went through. Is it right, the humoral, the vascular, all kind, but now they discovered that genes are playing big role in that. So the genetic studies are actually working with full speed. And then there is modulation, neuromodulation, which is also a popular topic. There are some neuro researchers here as far as I know. So go for it because you can help a lot of people. So genetic linkage was revealed in 2012. And since then, especially those migraines with the aura, so they usually affected by this. So they will have, I think, soon new treatments related to these genes. So how is it starting in the deep inside the brain? Although you feel it here and temporal, but it starts very deep inside with all these chemical changes. Then it goes to electric impulse, goes through the brain. So that's why people have the visual auras. Many of you had visual auras. They see bright lights and all this, and other, sometimes it's not, depending where this electric wave goes. Sometimes people have numbness, tingling in one side or another. They end up all in the ER. They think they had a stroke. It's very scary at the beginning. So we have to explain that it was not. So they have so many MRIs and everything. So there is all these changes, the flow, the blood vessels, inflammation, trigeminous. So it's a very complex feature. That's why we have so many different symptoms with the migraine. It just occurred to me that in the past, I read about in the 12th century, very famous, very intelligent woman who was a nun. and described the visions. And she became very famous, almost a saint. So she saw this beautiful, she thought that she saw heaven. So she saw this beautiful crescent moon, and then the angels started to fall, beautiful lights, you know, like a kaleidoscope and rainbow, and then they were getting bigger and bigger, and then after that, she felt and disappeared. So I'm sure she had auras, but she wrote all this, and she became like a saint. So I don't want to go, we talked about that the complexity is the neural circuitry of pain. So it's complicated, and the medications which we use affect those. So the cortical spreading depression goes through the whole brain and then affects other parts. So genetic studies, the new drugs will be coming out, but they started to use actually this, the glial cell activation. They started to give naltrexone, naloxone for migraines, which I personally haven't tried, but some clinics tried to do it and they thought it was helpful. Hormone therapy for ladies sometimes can be helpful. So lifestyle alternative treatments, of course, were always thousands of years ago and now. You can see massage, dietary supplement, avoiding the triggers, and a lot of positive changes in life. I will talk a little bit about it. And when the symptoms begin, and if you have a medication, don't wait. Many people wait. They say, oh, I'm just thinking maybe it will go away. Really, you have it 20 years. It's always a big, huge migraine. But I want to wait a little bit. Let's see. You have to take it immediately, because that's how it works on that chemistry, as you see. It's not a painkiller that your knee hurts. So it's just a little bit of a treatment. And so what did we use since ancient times, and we use it now? We can use also the biofeedback, acupuncture, Tai Chi, cognitive behavioral therapy, and dietary supplements. I do suggest to my patients the dietary supplements, and I get it all from the Headache Society, American Headache Society, so serious journals. They did studies. Riboflavin is B2. It has a good effect. A lot of things which you see in the CVS, whatever on the shelves, a lot of these homeopathic things, most of them were not studied against placebo, but for example, these were. The coenzyme Q10 was studied, magnesium was actually studied, and it helps not only migraine prevention, but the sleep too, because it helps the serotonin imbalance. So it's very good for the sleep too. And if you have the cramping, muscle tightness, that helps that too. So electrolytes. Why do we tell electrolytes to take electrolytes? It does help the homeostasis imbalance in the migraines. It turned out genetic factors play a role, that some people have hypersensitivity. They don't have the balance in the electrolytes, and we have to help them. We tell all the people that you have to have low sodium diet, not for migraineurs. You need your sodium, actually, extra sodium. It sounds weird, but that helps. We're getting close to the end. Wanted to emphasize that it's a public health issue, serious social and economic consequences. 12% of the population affected. And so it's 38 million people. You know how many headache specialists are? 500. So it's a huge lack of treatment. And that's why maybe you go to your primary care, who is well-meaning, wonderful person, but will not know about this newer treatment at all. They don't know exactly what, it's too much to follow up. So it's a good idea to see a neurologist. Most people, half of the people never even saw a doctor. Like 25% are totally undertreated, were not even treated. So, and it's happening now every day this week in my office. There are a few little pleasant little things how people have experience with that. a few famous migraine sufferers. So you see Julius Caesar, Ulysses Grant, Tolstoy, Jefferson, Chopin, and a lot of other. Marx had horrible migraines. They were so grouchy then, not doing that well. So there are a lot of other people even currently. So very famous was George Bernard Shaw, who met in the Nobel Prize, ceremony Nansen, who discovered the North Pole. So Shaw said that, do you do anything with the migraine? Are you looking for the treatment? He said, no, I discovered the North Pole. Who cares about the North Pole? Nobody cares about the North Pole, but the headache, everybody is suffering from migraine. Why don't you look at that? So you can learn to be in control. And it's very important if you are informed. Seek neurology help, because it can be something else. It can be a small tumor. It can be a little stroke. It can be an aneurysm sitting there, malformation of the blood vessels. Sometimes people have a damage to the arteries and they don't know about it, can end up with stroke. So it's a good idea to see a neurologist. The other thing is that you might be misdiagnosed. Not every migraine puts you to a bed with a cold glass in your head. There are many different ways, and it's hard to differentiate and treat it. You know how many people I have who have 20 years, I have these sinus headaches all the time, and they give me antibiotic, and it doesn't help. What could it be? Oh, I just have to lie down with this pounding headache, go to bed, next day maybe I am better. So they have migraines. So it's a good idea to see a neurologist, review a detailed trigger list, which I gave out all kinds of papers for you out there, trigger list. Also do a very good diary. If you do that, it's half of the treatment already and the success. Put down everything, not your opinion, just the facts. If you had a headache, what did you eat, drink, did, what time of the day, weather, hormones, stress. It takes you maybe 5 minutes of your time, maybe if you are very busy, but it's worthwhile doing it. And then be very well hydrated, aim at about 56 ounces, and add the electrolytes twice a day, magnesium at the end of the day, the vitamin B, especially the B2, and the coenzyme Q10. And you can do all the other things, of course, the stress reduction, the lifestyle, the stress-free, sleep hygiene, everything, but you might need a good treatment, most of you. And then your neurologist might help you with this wonderful new treatment, abortive treatment and preventive, but you need to work with the neurologist, and then you will be like a different person. And it is not just a headache. Don't settle with just trying to live with it somehow. That's how I might. No, you don't have to at all. There are good treatments. Don't forget it affects other people too. It's not just you. It's the family, your co-workers, your lifestyle, your trip, everything. So it's important, and you do not need to suffer alone. There are whole communities now, headache communities, online, media, neurologists. You can actually, I'm not here to solicit patients at all. I have enough, but anybody in this community who called me, I talk to them for free for anybody, advice where to go, what to do. So feel free, just seek for help and we will help you with everything. And this is just, I put it out there on papers, the Chronicle, if you want to look at. I had a nice podcast about migraine. It's about 13 minutes, but it tells you a lot of information. It's also out on the paper. And just finish with that. The Sumerian poet in 3000 BC, you see how he imagined the Garden of Eden, land of Dilmum. And what does he say? He says, the sick-eyed says, not I'm sick-eyed. The sick-headed says not, I'm sick-headed. So we will keep working on it, and thank you so much. I take questions. I take questions here and I take questions later on.
We can start with a few here. I can lead it off. So you talked about how there's this treatment plan, but then and then also there's these new, more advanced targeted drugs. What is the process for getting those? Like, how many meetings and what are the conditions under which someone would not be under this management plan, but would go on these very strong drugs?
Oh, good question. I have the first meeting generally with the patient, and actually I sit down, not looking at the computer, sit down with the patient and take a good history. And they tell me a lot about their history and everything. So then I do not give them immediately some kind of medications unless they have really horrible headache right away, which we need to treat. I give them the little diary, the trigger list. We start all these other non-medication treatments first. They give me their, then we meet each other, let's say in 3 weeks or so. They have a little diary. And then we, based on that, if we need to do tests, brain scan, we do. Not everybody. I never had a MRI in my life, although I suffered from horrible migraines. Lying down on the stretcher when I was on call was awful. So, but if there is any suspicion for anything, the so-called red flags, we order brain scans, and then we decide individually, do they need a preventive therapy? Do they need one of these newer treatments? Or do they are okay with the triptans and stuff? So we start that. I have several samples in my office. For example, the new ones, I love to give samples. So why should they pay all kind of money when it maybe doesn't work? So I give them samples. We go through it, what to expect, and then we see each other again in about 3-4 months, 3-4 weeks. But if there is any problem, I'm always free to be called, and then we talk. If it's working, then I call into the prescription to the pharmacy. And these days, the coverage is pretty good because these are so powerful. Botox, you talked about the Botox, it was very expensive, very expensive. But then, you know, the insurances do the cost benefit studies. So when they added that all these drugs which people use for months, years, the ER visits, everything, it costed more than these drugs. So now they cover it. It's pretty good. Yes.
You mentioned 10 years ago, I met with the then doctor who wrote a book, How Was My Life in the Shadow of My Great Grandfather. And she mentioned that she was treated by a Hungarian doctor. You know, some people here, you know, by any chance, who was a Hungarian person?
Where here?
Here.
Oh, Hungarian doctor. I don't know. Unless it was, I don't know how many Hungarian migraine doctors around. I know neurologists, but I would be happy if it was me. I hope it was me. Oh, not really, but.
Just a very quick question. You mentioned multiple times that millions of people suffering from migraine. And one of your slides, you mentioned that there's only 500 migraine specialists in this country.
Yeah.
How can that be?
Well, that's a good question. That's a good question. I wish there was more. There is American Headache Society, and then you can get certification through that. I had when I started in Concord, I was the only female neurologist, and migraine is much more frequent with women. So they started to come to see me. So I get so much of experience that, you know, I feel very comfortable now, but there should be more because it's a devastating. Everybody thinks that maybe the stroke or MS epilepsy is the more frequent. No, not at all. It's the migraine. And very devastating for family and affects everybody. It affects no matter what position, what your job is, it affects people. And I showed just a few examples. It affects the life. I had doctor who was supposed to give the big lecture of his life. And then, you know, there he was lying down and throwing up. And so that's not a good situation. I hope we can work on it more. I would like to be an advocate a little bit based on all this for the community. Yes. I'm sorry.
Is it true that people with migraine, they have a higher chance to get stroke?
Oh, yeah, there is. The question was that people with migraine, do they have higher risk for stroke? It's a little bit, not too much, but especially women who take hormone therapy and they have any kind of neurological symptoms. So anybody with aura should not take any hormone therapy. And as you know, it's most often it's the visual aura. If I saw any strokes, they were in the occipital lobes, actually. And unfortunately, it happened a few young people, young women. So it is true. It's not a huge difference. I saw it only in women, unfortunately. And some of them were on birth control pill, and the smokers. If you were a smoker and birth control pill, it's like 10 times higher risk. Otherwise, it's like 3–4% higher.
You mentioned shortly that corticosteroids as modality of treatment are short release for like migraines. So I was wondering, what's the mechanism of action? Is it only the pain release, or is there a neurologic component?
Oh, it's more the anti-inflammatory, and in some ways the pain. You know that the neurosurgeons, after the person had a horrible spinal cord injury, what do? They give them steroid, decrease inflammation and swelling and all this. There are the people who have this, we call it migraine status. It's going, doesn't go away, or they go, have you heard of rebound headaches? Rebound headaches, when you take the medication. It doesn't have to be narcotic. It can be your Imitrex. Excedrin is really bad. So they take it every day. But doctor, you have to understand that's the only way how I can function. So they get mad at me and stuff. But sometimes that's how we stop this cycle, a taper of steroid. Not too high dose, maybe 10 days. And then it really works like a charm. Just have to warn them that they might get a little mean or a little bit, agitated. I give them a little lorazepam. Works beautiful. Yes, Julie.
It was very entertaining and very educational. As we were laughing about the medical history of this whole thing, I just had this kind of functionary stuff, probably not going to be that. It happened before then in Debrecen we found in the medicine's library some very old books, and we left our hands on because there were so many wonderful things that. So of course, I think we are much better off now. Nobody minds the diagnosis and the trepanation that we don't do that anymore. But complex diseases and complex treatments always tell you that we have no idea, and we don't know how to do it, and we are still in the stage. And I just wonder, so we need some very significant humbleness here, because I can imagine that 50, 100 years from now, people will laugh about what we do today. So we have to do it with very something.
We have to have respect.
Yes.
That's why I love to read this. They were brilliant. They were smart.
There were some people were thinking carefully 2,000 years ago, and they have some good ideas, obviously, much less knowledge than we have now.
Yeah, Henry VIII's doctors, they treated him with the Godthrough for his terrible headaches, and we thought how silly they were, and here we go. That's yes.
What percentage of patients with migraine diagnosis gets anti-CGRP treatments, and what percentage of those do not respond?
Oh, most people, a lot of people at the beginning, I think that these ones, the new ones, about 75% they respond. The triptans were like about 50%, but we can change them. Sometimes we can combine. So the new ones work beautifully, over 75%. Botox works also very well. I had only, I started in 2010, and I had only 3 3 out of the 250 people who did not respond. It's amazing. I couldn't believe it. So a pretty high response rate, but if they don't, we don't just let them, as somebody told me today, that, oh, it didn't work. The doctor said, I don't know what else to do. No, never do that. No, there are other treatments, combinations. We work together. It does help.
What percentage of patients that have migraine get anti-seizure?
About how much, what percent get treatment or?
The anti-CGRP.
Oh, CGRP. Oh, that's relatively new because it came out about 4 years ago. So many patients who come to see me, they are already on a triptan or something like that. And even if I would love to start them on the CGRP right away, some insurances want to try like 1 or 2 other things. Not everybody, but when I ask them deeply enough, and I ask, so what did your doctor give you when you were a teenager or 20? Oh, yeah, they gave me Fioricet or gave me some sumatriptan, but I threw up, I hated it. So sooner or later, they will say that they did get something else, and I'm hoping to give them the new ones because they don't give side effects. And that's so important for me with treatment, either migraine or MS, whatever, to give the least harmful medications. Yes.
Is there a link between
Estrogen? Oh yeah, of course. With the estrogen, they drop the serotonin. And if it happens, and sometimes it happens at ovulation, happens in during periods. And to answer some of your questions, Charles, over there, the CGRP, some of those, the beauty of this, which I did not bring out here, that you can use it almost as a preventive therapy for predictable headache. Let's say there will be a estrogen change or other hormonal change. You can, or you will fly, or you will see the unpleasant in-laws, or whatever. You know that you will have a migraine. You can take it in advance. Actually, it is approved that way to use them. So it's very good. So some people use, sometimes some therapy, but if people have with aura or neurological symptoms and we want to give them estrogen for, it doesn't work that well. So that is sometimes, I just had a person yesterday who did beautiful during pregnancy, had no headache at all. Some people have terrible ones. So it's kind of individual, actually.
Let's do one more from back. Yeah.
So you talked about the side effects of the triptans, constipating patients, but you said CGRP doesn't have side effects. I have never heard of a drug that has no side effects. So maybe it's just side effects?
Well, yes, you are right. Everything, if I challenge you, I would say in the past, open the PDR, which was this one, but you can just do online. Everything, if you open Tylenol, you will see 80 different side effects listed. You can get diarrhea, constipation, you can get, so everything. But this one's the only side effect which I saw. I did see side effects. Constipation. Constipation in few people. When I used the Qualipto, the pill form for prevention, a couple of my patients said that they lost weight and they loved it. They wanted to stay on it. They taper the dose. You can change the dosage.
No, but I mean, if it doesn't have, you take the pill, it doesn't have, how long do you have to wait to take the next one?
To have the effect, when does the effect comes?
Yeah.
Oh, very fast. The preventive therapies, they work within the injections, 3 weeks. And the beauty of it, that some drugs, what you take, probably you notice that you take the medication, they start to lose effectiveness over months or years. This is increasing. Every month it's increasing. The pill form, the Qualipto, helps within a week. So that's really very good. The injection form about 3 weeks, I see. The pill form within a week, very good.